Welcome to our show, Dr. Bilal Khan, and we here in the studio we have Dr. Bilal Khan, who is a very respected gastroenterologist in Dallas area. And Dr. Bilal Khan graduated from Dow Medical College in Karachi, and he did his medical training and gastrointestinal fellowship training at Wayne State in Detroit, Michigan. Welcome to our show.
Thanks for having me, Dr. Kakari.
Thank you, sir. Sir, today our audiences want to know about, we speak about routine screening colonoscopies and upper endoscopies. Would you kindly enlighten our audiences about that?
I'll be happy to. Colon cancer screening is an extremely important test, which is more often ignored, but I'm glad it's been actually in the limelight recently because some of our presidents have suffered from this. And some of our very famous celebrities, including some of our newscasters. And so colon cancer is actually the second most common cause of cancer death in men, actually. And it's one of the most preventable forms of cancer there is, provided they get a routine colonoscopy at an appropriate age. So for now, the recommendation is by all the cancer societies that they have a colonoscopy starting at age 50. Unless they have a family history of colon cancer, that's when they need to start having a colonoscopy at age 40, so 10 years sooner. So that has to be kept in mind. Now, there is a lot of negative press out there about having a colonoscopy in the prep, but I tell you, I've taken a prep myself. It's not as bad. The colonoscopy itself takes about 15 or 20 minutes. Patients look very comfortable, they don't feel or remember anything. And it is therapeutic as well, which means during the colonoscopy, if we find anything abnormal, we take care of it right there. And what we're looking for are these polyps, which are small growths on the inside. And if we see them, we cut them right there. We take care of it, and we send for pathology. Because we believe it's the polyps that have a potential of turning cancer, if left alone.
So in other words, what you're doing could be both diagnostic as well as therapeutic.
Absolutely, and that's the whole idea behind doing the colonoscopy.
Yeah, one of the things that it really is very, very important is that by doing these colonoscopies on a regular basis, you can actually prevent unnecessary deaths, unnecessary suffering.
Absolutely, and one good news I can share with you that overall the colon cancer death rates have actually gone down by doing colonoscopies.
Wonderful. That is excellent news, especially in this day and age when the awareness is becoming more and more with the public. They must be aware that this has really positively contributed to the health of the community.
Yeah.
What I request you, Dr. Khan, is that for our audience, could you walk us through the different steps of colonoscopy? How is it done? How do they get it done?
Sure, I'll be happy to. So once the patients are scheduled, at the time of scheduling, they're provided with the information. And the most important step is taking a prep, which means they need to be cleaned out prior to coming to the surgery center or the hospital to get their colonoscopy. And these are detailed instructions, which means they have to drink the stuff the night before the test and sometimes morning of to get themselves cleaned out. And that includes drinking the stuff, which is a strong laxative, to flush everything out so that the colons are clean in order for the doctor to take a careful examination of their insides. After they take their prep, they have to have somebody to drive them to the hospital or the surgery center because they will be getting some anesthesia or sedation to keep them very, very comfortable during the procedure. Once they're at the hospital or the surgery center, they will get an intravenous sedation, they will be kept comfortable, and the doctor with a camera or a scope will take a good look around the colon, carefully taking good look behind every nook and corner to see if there's any evidence of polyps. If they see any polyps, which are small growths as I discussed before, they will remove those slowly, gradually throughout the colon.
Dr. Khan, what is one of your biggest challenges in your practice these days?
One of the challenges that we face quite frequently is patients not scheduling their procedures because of not having an insurance or unfortunately having a high deductible. Although they have insurance, but once they look at their deductible, they get scared, they just outright either not schedule their procedure or cancel at the last moment. Fortunately, you have helped out a lot in that regard. Can you explain that in more detail?
Absolutely. At our center in North Texas Teen Care Surgery Center, we offer our patients a single payment option. What this means, single payment option means to a patient, is that they will pay very affordable one payment that includes anesthesia fee, surgeon's fee, and facility fee, and at times even a pathologist fee. And these rates are so affordable these days, and in the last 2 years, a lot of patients, even with the insurance, with the high deductibles, they chose to use this single payment, affordable payment plan to get their life-saving colonoscopies done. As you know very well, Dr. Khan, in the last 2 years, you have saved the lives of at least 2 or 3 people with, by catching these cancers in a very early stage. And we are very grateful for your services.
We too. My office really thank you in that regard for accommodating my patients for either no insurance or patients with high deductible. And we really thank you so much.
You're welcome.